All right, folks, we're back. I'm your host, BKP. We're at downtown Blue Ridge, Georgia at Sycamore Crossing. We always like to open up with thanking Georgia Cancer Specialists affiliated with Northside Hospital Cancer Institute for this segment that we call Ask the Doc. You know, we have new viewers every week. It's exciting, so I have to introduce you, Dr. William Whaley. Now, they know you out there.
Yeah, I got to tell you, the funny part was last week when you weren't here, and Jolene was here. So Jolene goes through this thing, thinking, and I said, "Who are you?" I said, "You're sitting in for the guy who doesn't know a bad hair day." And that got her all flustered up. But we did a great segment last week.
I watched. I want to say I watched because I was waiting for somebody to show up, a contractor for something, and so I turned on the TV waiting, and I watched. I really enjoyed you guys, and when I talked to her earlier in the week, she said, "I'm doing Ask the Doc. I've been waiting for this opportunity." She enjoyed it so much, and you guys did.
And Ray was very nice to her. He thought, he was wearing his fancy socks and his shirt.
Who? Ray?
Yeah,
oh.
Ray. That's
the
Ray.
Empty chair?
Yeah, it's Harvey the Rabbit or something, right? You know what he's doing today?
Well,
he's got a family opportunity.
Yes.
To do some sort of, man thing with
Yes.
work with a son-in-law. Yes. I mean, I wouldn't miss that either. So I don't know exactly what he's doing, and I'm sure that the son-in-law is a lot better at it than he is, but it's going to be a good experience for him. And then the next 2 Fridays, I'm going to be off with 7 grandchildren and 4 daughters and son-in-laws and stuff, doing stuff, and so Ray's going to sit here by himself while I'm doing important stuff. This is summertime. And if you get a chance to go out and plant a garden with your son-in-law, or go plant a garden with your grandkids, or go camping with your family, go do it. And then just put this on your VCR and you can read it when you come back.
Right.
That's what I told the audience. I was looking at the camera.
I agree.
All right.
I agree with that 100%.
All right.
Dr. Tidman, we hope you enjoy what you're doing today.
And he's not watching, I promise, because he's out there doing the job. He might be VCRing it, though. Is that what you call it, VCR?
Come here a minute. They don't have VCRs anymore.
What?
Okay.
They don't?
Just move on with the question.
I'm not technical. What? They don't have VCRs?
DVR.
What? I don't even know. I'm not a technical guy.
Let's move on from how to record the program.
I think I may have just proven
cancer question.
I may have just proven that I'm not a technical guy. I keep up with cancer.
Record the program and watch later.
I keep up with hockey, and I keep up with
don't
with
ask him a hockey question.
All right.
Don't try to take him on when it comes to hockey trivia.
The first question is this is a really important question. I'm going to kind of introduce it a little. What you got is a well person who, for reasons that are not germane, has had a test done. And the test was done for a purpose, but also found on the test was an abnormality. Now, I have said before, you're so fortunate when you go into the hospital or the ER with a broken rib, and they do a scan and they say, oh, there's a small spot on the pancreas, right?
Yes.
I say, you're only going to cure pancreatic cancer if you find it when something else is being evaluated. Otherwise, it has to be advanced before you find it, right?
So many times, someone, it'll start out with, I went in for
this,
right.
but they found that.
Yes.
Okay, well, this is one of those questions. And then the second part of this is that everybody, I don't know about you people up north, but everybody, how about that? Everybody raised in the South who has ever whacked his thumb with a hammer or cut his foot in the yard or something and gotten a semi-infection, and then has had a lymph node swollen up, who's got a living grandmother, says, he's got a kernel under his arm, he's got a kernel in his elbow, and a kernel means a swollen up, inflamed lymph node. And if you think a kernel means somebody in the military up north, you missed out on a whole southern thing here. So this is going to touch on some folk medicine and southern medicine and some science. All right, my sister is 67 years old and has no issues except low thyroid and except for orthopedic injuries from athletics. Now listen to that. So you know that she's an athletic woman.
Yeah.
She's had orthopedic injuries, and
She
she's
hasn't
got
had any surgeries.
yeah, and no surgery, and she's got low thyroid. Well, like 30-40% of women when they get to 60 years old are on thyroid. All right, she went to an urgent care center with a mild bellyache. Now she did not go to the emergency room. You got it? So she just went to a doc in the box thing, and that's a big difference here.
Well, wait a minute. You know, yes, but she's up to date on every test.
Every test, right.
Right.
She's up to date on every test, colonoscopy, mammography, everything else. Okay, so she's.
And I think that's important in here is because I think that's important in this part of the question because you should be up to date on tests.
Right. We know she's healthy and not neglecting herself.
Exactly.
There you go.
Exactly.
And she's up to date on colonoscopy because this is an abdominal pain. All right.
Exactly.
Now it's not a terrible abdominal pain because she goes to just a doc in the box. Maybe I don't even know if she was even in. Let's just say, for the sake of argument, she was visiting Blue Ridge and she lived in Atlanta.
Exactly.
So instead of going to the ER, she goes to an urgent care center where there's a doc there. So she's not terribly ill. And it's described as a mild bellyache. All labs were normal except a very slight increase in her white cells. That's important. A CT scan showed diverticulosis without diverticulitis. Now, everybody over age 50 has got some pockets on their colon. That's diverticulosis. If it's inflamed, that's diverticulitis, and that's an infection, and that would raise your white blood cell count. So
white blood cell raise fights infection.
Right, but she's not infected, and her white count's a little bit elevated. So that's.
All right. Well, let me ask you this question,
Right.
not to stop.
No, don't
here,
go
but
ahead. You're doing
if your white blood cells are elevated, first and foremost, that should be because it's fighting infection.
Or there's something else wrong.
Right, but if you don't have infection, that's when there's something else
That's
wrong.
something else wrong. Right.
Is that the only time white cells are elevated is when it's fighting infection? So if you don't have infection, wait a minute, I need to...
Generally, yes, except if you are running, doing some very vigorous exercise, you're sort of stirring up the pool that's in the
Okay.
blood, and it'll be up for a few hours and be gone again.
All right.
Okay, now, so she went to this urgent care center. She's not very sick. A CT scan showed diverticulosis without diverticulitis.
So no
Now,
infection.
And
that's the defining
here's
thing.
the big deal. And minor lymph node enlargement in her abdomen and stomach area. So those are not explained by the CAT scan. The lymph nodes are enlarged. The urgent care center wants her to see an oncologist. What might be wrong? She feels fine and doesn't want to go. Now, that's what we have emphasized here again and again and again. You go to the ER with a broken rib.
Mm-hmm.
They say your rib's broken, but we see this swelling around your pancreas, or we see something on the top of your kidney, or there's something else in there. Well, the rib's going to heal up in a few weeks. That thing hadn't gone away, right? It's still there. So we always encourage you to have that evaluated. So we're going to go through this in a minute, and I think that urgent care center was pretty sharp because they said start with an oncologist. They didn't say start with an infectious disease doctor.
Right.
Okay. First of all, enlarged.
Are you going to tell me in that question what the doctor picked out that he went to oncologist?
Yeah, I am.
Okay.
Okay, I am. All right. And he had a choice. So he could have gone other ways, but he made the right decision here.
Well, that's when you said he made the right decision. In this question, you've already picked up why that doctor went to oncologist.
I did.
Okay.
Okay. Now, what I just told you about the kernels. They're everywhere.
Right.
But there's a lot of missing. Put up that first one over there, will you, Lonnie? This first one is that picture that shows this did not come out of a high school high school health book, but it could have. You see this? This is the areas of known lymph nodes. You got them behind your kneecap, you got them in your neck and under your arm that would have, you can pull that down now. You can pull that off the screen if you want. That would have responded to these little injuries where your grandmama said your kernels were swollen, right? Mm-hmm. Because those are all areas under your arm and your neck that are external where your grandmama could have felt them.
Right.
All right? But we're going to show in a minute that that's not the area that was enlarged on this thing, was it? So first we're going to talk about these lymph nodes that she's got and why this guy chose the oncologist and not the infectious disease doc. Now, if you just put the next one up, and now that I know that says epidemiologic clues to the diagnosis of lymphadenopathy. So what that means is big lymph nodes, what can cause it? Over on one side, you got exposure. Look at this stuff here. Just quick. What's that say?
It says cat.
Cat, undercooked meat, tuberculosis, high-risk sexual behavior. When we get to the news, we're going to come back and talk
That's
about that.
why I can't have a cat.
Yeah, all right. Occupation, hunters, trappers, fishermen. Travel, you've been to Arizona, southwestern United States. There's 3 more pages of this. 3 more pages of this, and the last one you get to the bottom of is HIV, okay, or that human, anything that stimulates lymph node enlargement. Okay, pull that down. The reason that this guy went to this doctor went.
Let me see that second, just a second though. But it's showing the diagnosis. I mean, for your lymph nodes, like when you see
that's
cat,
the exposure, the diagnosis.
Cat scratch disease,
fever,
right?
Yeah.
I see.
There's Lyme disease.
Lyme disease, right?
That's common up here, right?
But these are all the things that could cause
generalized lymph node enlargement.
Right. Okay.
Okay, but this is generalized lymph node enlargement. This is not what this patient has.
Right.
This patient has lymph nodes that are only in the abdomen. Only in the abdomen. Okay, now put the next one up. This is just a picture of what's called mesenteric lymphadenitis. That's an infectious infection in the mesenteric lymph nodes, and it says, is that cancer? You can pull that down now. But so that's what they're saying is, if lymph nodes are enlarged in the abdomen, how do you know if it's infection versus malignancy? It now becomes a diagnosis of exclusion because you've got that thing there saying, is it cancer or is it infection? You got it? So now you got to know one way or the other before you know which way to go. Well, this patient doesn't have fever, chills, or any sort of infectious symptoms. All she had was a mild bellyache, right? Okay, go to the next one. So this talks about how the lymph node bearing areas of the body, in addition to all those things they showed you there, is the biggest lymph node in the body is your bone marrow. The next biggest lymph nodes in the body are the spleen and the liver. And then all these, you can pull that down now, all these lymph nodes within the abdomen. Show the next one, and this is one of the pretty little cartoons we show. So what they saw there, here's the liver, here's the stomach, and the colon, and these things are scattered all about the abdomen because that's what they were looking into, right?
Right.
It was a bellyache. Those don't explain bellyache. So pull that one down and come up with the next one.
But we have the lymph node enlargement in the abdomen. And that's what we're looking at.
That's what you're looking at.
Right.
Now, pull up the next one because this gives you a list of some of the things that can cause it. So you can have tuberculosis. Well, that's not it. I mean, we pretty clearly she's not that kind of sick. There's infiltrative diseases, which you're not important with. But if you have this abnormal chronic lymphocytic leukemia, you see, remember, a lot of people just have an elevated white count from some reason. Her white count's elevated, right?
Yes.
Well, it didn't tell us that white count might be elevated because of lymphocytes. Only told us it was elevated. Now, one of the most common things you would see are these lymph nodes being enlarged if those cells in the peripheral blood had been lymphocytes, or, you can pull that down now, or if that was lymphoma. So, you've got all these lymph nodes, you're gonna have to have an answer. What is the simplest way to get an answer? You remember what the simplest way to get an answer is? That help a little bit right there? You know, when we talk about a mammogram, so
Right.
I say, if you got a mammogram and it shows us, your right hand should look like your left hand,
Yes,
and your
yes.
right eye should, okay, so you got a spot on one breast, it's not on the other
Yes,
breast.
yes.
Even if it doesn't look like cancer, what do we do with it? We've got to explain it. We put a needle in it, we biopsy it, right?
Yes.
Okay, put up that next one. This is how you do a needle biopsy of a little bitty lymph node that's not any bigger than that, totally safely. Well, totally safely, I mean 99.5% safely. But this is a cross-sectional CT scan of an abdomen right there at the tip of that needle. You can see how that needle shines right there. That enlargement that's not very big is the lymph node. All right, you can pull that down. So the question is, what might be wrong? Well, what might be wrong is I'll give you an easy one. There's nothing up there now, right? We're just talking. What might be wrong, Jane, are you awake? Listen to this. It does not tell you when this woman had her last COVID immunization, if she had one. Now, you remember we talked before, back early in the COVID immunization period, after the first vaccine came out, that there were millions or thousands of mammograms being taken that were abnormal, showing enlarged lymph nodes that then went out and got biopsied or whatever, and they were on the side of the arm that took the COVID shot, remember? So the COVID shot we don't do mammograms within 3 months now in women unless they got a real cancer feeling thing. We don't do screening mammography in women within 3 months of a COVID shot because it can cause lymph nodes to be big. So one of the things that could have happened to this patient that is not in the history is, let's say 2 or 3 months before or 2 or 3 weeks before, she had a COVID shot. That could have given her enlarged lymph nodes. It could have given her a bellyache, but it would not have given her an elevated white count. But when you ask what could have happened, or the mesenteric infection, she didn't have the fever, she didn't have the chills. So you've got to get a piece of that lymph node, and then it may show if it shows a lymphoma at all, it's going to be that indolent, well-differentiated follicular lymphoma that is the lymph node equivalent of chronic lymphocytic leukemia that is treated by, how do we treat asymptomatic chronic lymphocytic leukemia? Now, Lonnie, you've been doing this long enough to where you should remember, what do? Observation, watchful neglect, remember? Got it. You don't do anything. You just watch it. Well, that's what you may find that in this. The other thing you may find is you stick a needle in there, say it's reactive, and it may well have been to some previous COVID shot or to some other systemic illness of which we are unaware.
Okay, so
So that's why the oncologist. Let's finish one more thing.
right.
Let's say that this urgent care doc had his internship and residency at the Mount Sinai Hospital in Boston. The biggest, most famous internist at that institution was an infectious disease doctor, like Dr. Marlowe, right?
Mm-hmm.
And so he might be thinking tuberculosis and fungus infections, and so he might have had an ID sort of background, and he might have sent the patient to an infectious disease doc. This doctor here made the right choice because the infectious disease doc might go off in 100 sets of blood tests and then test you for mono and Epstein-Barr virus and HIV and everything else. And the simple thing to do is to take that elevated white count, run it through a flow cytometry machine, and stick a needle in there, and you can get that done in 3 days. This ID workup takes weeks.
She feels fine and doesn't want to go.
I tell her to go.
You tell her to go?
There's one option to that.
Okay.
And there's not a bad option. particularly in this period of time, is that the oncologist very well will take additional history. And if he gets the additional history that she had the COVID shot, or if when she gets the oncologist the white count's now normal, he may say, let's wait 90 days and repeat the CT scan. So it's not necessary that he's going to do a biopsy.
Right.
He's going to take information that's not in this question. And he might just say, let's watch this for 90 days and then do another CT, particularly if the white count's normal, or she's had a COVID shot, or she really totally feels great, no more bellyache or whatever. But the oncologist was the right place to start.
All right, let me ask this, and we'll move to the second question. But so many of the questions that come to us on Friday start the same way and end the same way. It's very common for people to say, I feel fine.
Yeah. A couple of weeks ago, you were saying, I feel fine, but I might not be fine. That's what you were saying.
Yes, and that's not uncommon in the questions. How common is it for someone to come to you but I feel fine?
It's every day. It is every day that I see a patient like this, that somebody has done a test, primary care doc, has done a test, PSA is high, and he's got early stage prostate cancer. He has no symptoms.
But I feel fine.
Feel fine, yeah. Okay, now, this patient could have an indolent lymphoma.
Right.
She feels fine. That patient who went into the hospital for a fractured rib, and the x-ray that they did showed that he had pneumonia. They did a CT scan that he had a pancreatic cancer that's tiny. He feels fine. So I'm not trying to get people to panic and go run out and do CAT scans that feel fine, but many people who have early stage malignancy or even advanced malignancy can feel perfectly normal.
So many of our questions will start, my brother's a healthy, or I feel fine.
Yeah, well, I'm sorry Ray's not here, because people that feel fine, that are, above the age of 30, let's just let the 30-year-olds and below do what they want, need to have a relationship with a healthcare provider. Mm-hmm. Now, many women in that age group are having children, or going on birth control pills, or, having menstrual cycle problems or whatever, and so their primary care relationship is with a gynecologist.
Right.
Obstetrician gynecologist. Men need to have a primary care doc, and if they're in their 30s, it's probably going to be a family practitioner. If you play baseball or something, or golf, it's going to be some guy that you've met that also plays baseball or golf that you can be simpatico with. You're not going to you're not going to have a good long-term relationship with a primary care doctor that you don't like and don't gee and haw with very well. So this patient here, we know, has a primary care relationship with somebody, because she's up to date on mammography and colonoscopy and feels well.
Exactly.
All right. Now, I ask people every day. I had one yesterday who has a malignancy in the prostate, who has not had a PSA or seen a doctor, and he's 55 years old, has not seen a doctor since he got out of the military when he was 22. And I asked this question. You heard me ask it before. Lonnie, what kind of car do you drive? How many miles do you have on it?
About 200,000.
200,000. How often do you get the oil changed?
Every
3,000 to 5,000 miles. Then I say, and when was your last colonoscopy? And when did you last go to the doctor for a blood pressure check or to have your blood checked? Blah, blah, blah. So then I say, I would like to purchase your car. You're taking better care of it than you are of your body. So when you say I feel well, that's that guy probably who isn't taking care of himself so well, but is getting the oil changed on his pickup truck. And this is Blue Ridge, Georgia, for you people that live in the city and you lease your car and you get a brand new one every 2 years. That last F-150 pickup truck I had, I drove to 268,000 miles, and I donate all my vehicles to churches or to charity organizations once I get to the point where I think they're beginning to cause me a little trouble. But that's always in the 200,000 mile range, and we take real good care of our vehicles up here. And I look out here and I see 6 things, and they're all pickup trucks except for this fancy car that Bruce drove in here. So we all drive trucks. We all take care of them till they got 200 and 300,000 miles on them. You need to take care of your body and go see your equivalent of Ray Tidman once you're 30 years old, and every 5 years go get an eye doctor and get a colonoscopy when you're 50, even though you feel well.
Thank you, Georgia Cancer Specialist, Northside Hospital Cancer Institute. Now let's get to our
Was I on my high horse?
That's
there?
okay.
Hey, was I on my high horse?
That was a horse.
A horse.
That was a horse worth riding.
All right, now.